Hello, bonjour. My name is Maria Medved, and I am a professor of psychology at the American University of Paris. This is the second episode in a series of three that explores the relationship between COVID-19 and gender. In the first episode, we looked at the coronavirus in men. In this episode, we focus on women. While men with COVID-19 are more likely to die of it than women, research indicates that women carry a higher disease burden than men. Disease burden is a medical and health term used to describe the impact of a disease or an injury on the everyday activities of people and societies. Do you have any ideas about which areas of life COVID-19 might especially affect in women? You probably do, but as a jumping off point, let's start with caregiving. Women perform a lot of care activities, both on an absolute level and relative to men. Caregiving can be what is called formal, having to do with paid positions, or informal, concerning family members and close others. In terms of formal caregiving, most nurses are women, most respiratory therapists are women, and most personal support workers in long-term facilities are women. Often it is about 75 to 90%. This puts women at higher risk of contracting COVID-19, and the case numbers reflect this. In terms of informal caregiving, it is most often women who are responsible for the everyday management of children and elderly relatives. In times of school shutdowns, women take on the role of teacher substitute more often than men, and it is well documented that women are more likely to carry the load of care for an older or sick family member. These responsibilities exponentially increase during times of a pandemic, leading to elevated levels of chronic stress and anxiety. Another impact is increased rates of intimate partner violence in almost every country. Women are unable to escape from escalating violent situations and are trapped with their abuser. In Paris, for example, the rate of domestic violence increased by 35% during some weeks of confinement. In Venezuela, there was a 65% increase of femicide in April 2020 as compared to the same month the year before. This doesn't mean that there isn't abuse directed towards men or that it doesn't occur in same-sex couples, but the fact is that the bulk of domestic violence is directed against women. It also needs to be noted that periods of restriction are also associated with increased sexual violence against girls. An additional gendered issue centers on sexual and reproductive health during pandemics. There is decreased access to menstrual products, increased rates of unsafe abortions, decreased access to prenatal and infant checkups, increased maternal and infant mortality, and lack of choice during the birthing process itself, ranging from, depending on the country, forced C-sections to no access to medical personnel at all. There is also decreased access to contraception. The UN expects 7 million more births than usual. Also, according to the UN, in the next decade, female genital mutilation is estimated to increase by 2 million, and there will be an added 13 million child marriages as a result of the virus, or perhaps more precisely, due to the social and economic uncertainty associated with the virus. There are many more areas of life which women have a greater COVID-19 disease burden than men. You can probably think of many more. Gender, especially women's issues, is not a priority during pandemics. One reason for this is because there's often inadequate women's representation in national and global COVID-19 policy spaces. Nevertheless, women and organizers resist and push back. In this learning lab, I have again tried to show that gender is in fact a central issue. Stay tuned for the final episode in my Gender and COVID-19 series. In that episode, I discuss challenges for people who are transgender, as well as social and demographic factors that interact or combine with gender, such as ethnicity and race. Thank you.